So I want to talk to you about the indications for or the reasons to use epinephrine versus Benadryl alone in the context of having a known or suspected allergic reaction. So bottom line is that epinephrine is an extremely safe medication for your child. It's very, very well tolerated. There are extremely few examples of any sort of adverse effect associated with the use of epinephrine for a child who's having an allergic reaction. And so when there's significant doubt, I want to emphasize that we really think epinephrine is the treatment of choice. But the indications that you're looking for primarily are airway or cardiovascular involvement. And in young children, it's almost entirely about the airways. That might be subtle. For example, your child might have hoarseness of their voice. That's an indication that the voice box is swelling. That's a clear indication for epinephrine. They might be repetitively coughing and yet still seem relatively comfortable. That admittedly might be related to upper respiratory congestion. It might be okay to take a little time and assess that further. But if they're having clear, and present, persistent coughing, again, that's an indication for epinephrine. It might be more obvious, so there might be, frank signs of respiratory distress, like pulling of the skin above the sternum or between the ribs or below the ribs, flaring of the nostrils, just rapid breathing, or what we call stenting, so the child sort of supporting with their arms in order to get breaths. And those are all clear indications that you should use epinephrine. Again, this is in the context of a known or suspected ingestion of an allergen. This is not your child who has an asthma attack that we want you to treat with epi. This is in the context of a suspected reaction. Now, when is it okay to use Benadryl alone? So your child, again, eats something, has some hives, is otherwise comfortable, maybe even has some gastrointestinal symptoms. It is okay in that case to use Benadryl and watch for any other signs or symptoms. If you do need to use the epinephrine, we want you to go to medical facility for observation for a couple of hours, because there is a risk of having a second wave of reactions.